Welcome back. From busy city hospitals to rural clinics, the same dilemma is unfolding. The demand for care is rising, and nurses are carrying most of the load. Tens of millions are already on the job, and the number is growing. But whether due to opportunity or cost, global staffing is uneven, and the shortage is dire, where nurses are needed most. Here's more on the situation. A global crisis that has been playing out for years. The backbone of healthcare is under growing strain. In 2023, there were nearly 30 million nurses worldwide. By 2030, that figure is projected to rise to 36 million. Now, on paper, that sounds like progress, but look closer. They would need to serve a projected global population of 8.5 billion people. African and Eastern Mediterranean regions are expected to face the most severe shortages in the coming years, despite having some of the greatest healthcare needs. Nurses make up roughly more than 40% of the global health workforce, so any shortage doesn't just affect hospitals, it weakens entire healthcare systems. Today, 1 in 7 nurses works outside their country of origin, a sign of how heavily healthcare depends on migrant labor. But the issue isn't just numbers, it's distribution. Many nurses are trained and ready to serve, yet they're not always deployed where demand is greatest. Nearly 78% of the world's nurses are concentrated in countries that account for less than half of the global population. That's even as countries such as India and the Philippines continue to produce nurses at scale. 10 years ago, almost 200 countries pledged to achieve the Sustainable Development Goals. A third of those goals are directly tied to health, including workforce expansion and financing. But global progress is slowing. India alone trains around 300,000 nurses every year. It's one of the few countries with enough supply to meet both domestic and overseas demand. But that balance is rare. Across much of Asia, the outflow of nurses to wealthier economies is straining local healthcare systems. The Philippines, long one of the world's largest exporters of nurses, is now grappling with shortages at home. And it is not slowing the pipeline. Instead, it plans to expand training capacity and produce even more nurses. Many countries are eager to recruit them. Singapore, for example, relies on thousands of Filipino nurses to bolster its healthcare system. In the Philippines, the promise of opportunity abroad now collides with a growing crisis of care at home. And that's where we turn next, to the Philippines' numbers and what they reveal about the future of global nursing.
Nurse Ralph Jason Ching has been working in the same hospital for 18 years now, but he hopes to leave the Philippines soon in search of a healthier work-life balance.
Ang bilis po ng hiring nila, no? I was fortunate enough na nagkaroon po ng isang employer. They finance everything po, from the review to the mga registrations and everything. Kasama na po yung processing ng visa.
Ralph Ryan Garcia is a newly minted nurse, having passed the Philippine licensure exam last year. But he's not planning to make a career out of it at home.
The quality of life that I could have abroad is going to be better than staying here in the Philippines.
Times have changed, and when I interview students, what is your primary motivation? Why do you want to take up nursing? They usually say they want to help their family. And helping their family means they have to leave the country. So I cannot do anything about it because that's the reality. That's the sad reality.
The Philippines and its healthcare conundrum. Nurses are taught and trained that the job is a calling. But to an ever-increasing number of new and veteran nurses, it's a ticket out.
Our nurses are globally accepted. And it seems that most countries that are developing health systems try to hire Filipino nurses, which is like, I now consider it not a problem, but our soft power.
In the developed world, coming under the care of a Filipino nurse is almost universal. For the Philippines, it's a source of national profit over healthcare pain. Some 300 to 350,000 Filipino nurses are spread out across the world, while their country is lacking around 160,000, according to the Department of Health. Filipino nurses are a labor product made for export. However, while the Philippines also churns out sailors, industrial and domestic workers by the tens of thousands, their migration does not carry the same public health consequences.
So sabi nga namin, pag nagbibitoan kami, 1 nurse is to 1 ward. Sa 100 patients, minsan 2 lang po yung nurses. So, syempre, nagkakaroon din po ng burnout sa mga nurses natin.
In some hospitals, 1 nurse would be dealing with 25 patients, 50 patients. But in fact, it's recommended dapat 1 nurse to 3 patients lang.
The government does not intend to curb nursing exports to address the domestic shortage, but it continues to work on incentives to encourage these healthcare workers to stay home.
We're trying to be competitive with our salaries. We've started to increase the government salaries for nurses, which is much higher than that of the private sector. So then we're increasing the other benefit packages for nurses, like housing, car loans, and other benefit packages, health insurance, so that they will be discouraged to leave the country and stay with their families here.
The government is offering more, but for many nurses, not soon enough. For Ralph Jason Ching, it's not about wanting to leave. It's about not having enough reasons to stay.